Hi, thanks for having me today. I have that coveted spot right before the break when we're all just kind of waiting to get away, but I do have, I'd like to share the Rain City housing experience with low barrier, or also known as highly accessible shelter provision. A little bit about that today. With Rain City Housing, we have a long history of low barrier shelter. The first one that we went to, a low barrier model, is the Triage shelter that's located in the downtown east side at Powell and Heatley. I think many people know that one with the neon sign there. And in the early 90s is where that shelter really started to make an intentional transition to a low barrier approach. To be informed strongly by harm reduction, and I wasn't with Rain City at that time, but the stories that I've heard is that the transition wasn't that easy, because I think that what was going on was still some of the traditional approaches around lots of criteria and strong push around whether it be towards abstinence or addressing your drug use in certain ways. So that happened then. But for today, I'm going to also focus mostly on the low barrier shelters that we've run for the last 3 years, that are also called the HEAT shelters. It's a partnership with the City of Vancouver and BC Housing funded. So mostly talk about the HEAT shelter experience. I've enjoyed what I've heard so far about the research, and I understand that this is a kind of a research based. I do have some stuff that I'm going to pull that is actual research, but I'm not a scientist either, so some of it's going to be a little bit of some of the stories from the shelters. So we ran a total of 8 of these shelters over the past 3 winters, and one of the amazing things that we found is that over those 3 winters, 300 people in total were referred into housing directly from those shelters. With Rain City, I'm talking about the low barrier shelter. We're obviously, strong supporter of, purpose-built sites, and obviously a housing first model. I've had the experience of new buildings like this that have come online, like the Lux building that we have at 65 East Hastings, or Fraser at 39th and Fraser, and Just housing that has people with their own washrooms and a beautiful new suite. I've had that experience of handing the keys to someone and showing them that place and seeing their eyes well up and just saying, having that feeling of moving into a beautiful new place. So obviously I'm really supportive of that, but I'm talking about a low barrier shelter for today. So this is a picture of one of the shelters that we run, the house shelter underneath the Granville and Granville Bridge. We had 2 of them there for a while, the Granville and the house shelter, across the street from each other. I remember one of our peer workers and someone who was housed there. All of the quotes that I'm bringing out actually are research based, because they came out in focus groups put on by an external, actually by BC Housing. So these are actual research, and they're quotes that came from folks who were staying there. And I got real curious about that, because this guy said that the shelters aren't like other shelters and they're unique, and thought, well, what's so unique about these? They look pretty rough, and they're probably places where you wouldn't ideally, they're certainly not purpose built. We make the best out of what we have, but I believe that it's our approach in the highly accessible projects. We opened 2 of these shelters in the West End in the past year, and when we opened them, it was incredible how the counts changed. We went from 267 folks that were homeless on the street down to 12, right? Through the initiative of the 4 shelters that were open, and obviously the new sites that were coming online, like this one. So, but it did make a big impact. I had the opportunity to talk to business owners in the West End, and they're so supportive of these shelters. you know, they told me about how disheartening and how hard it was every morning going to open up your store, and there's a bunch of youth that are sleeping in your storefront, and I'm just trying to open up, and they were all there, and they said, after these shelters open, I now don't have to wonder, you know, why are they here, where else could they go? And so the business community is actually very, very supportive of these sites. How do you get into one of these shelters? A lot of it's word-of-mouth referrals and referrals from the community and from other sites. One of the premises, and this started back at our triage shelter, is basically to cast the widest net to ensure that those the greatest risk and the greatest need get the services. So the shelters like this and a full-service shelter, they're a valuable commodity, and we really want to make sure that folks who living with some mental health or struggling with addiction issues get into these shelters. So we started, especially at the triage, with a concept of screening in, not out, you know, this commitment to making the most accessible housing for those with the most challenging situations, and often a really poor housing history are the ones that mostly find their way into these shelters. You know, what I found is that without these, people are just cycling through institutions like jails, hospitals. We've heard a lot about the numbers, you know, on that today, but Dean's not here right now, but he's pretty famous for saying healthcare by ambulance is a pretty expensive way of doing this kind of business, right? When you look at it from a cost perspective. Yes, shelters are costly, but I think they're a really important part of the continuum because they're that first point of contact, and they're a place where people get indoors. When they do get indoors, I remember a quote from one of the mothers, someone who was in shelter and then went to one of our supported women's housing facilities called the Vivian, and the mother said that my daughter had had 79 hospitalizations in the 10 months prior to moving into the Vivian. In the 18 months that she was at the Vivian, she only had 3 hospitalizations, right? That's a pretty dramatic number. It's one that we pulled out, and I just remember the quote. It's not that everyone has that massive of a reduction, but most do have a huge reduction in hospitalization usage. And if you think of the hundreds of people that we house or that all the other services house, there's a massive savings there, right? So the self-organizing community model is one of the things that we do there. You know, some of the obvious stuff that people talk about when we're referring to low barrier shelters is that, you know, shopping carts, accessibility, safe storage, pets. These seem like obvious barriers to housing, and they increase access, but it does get a little tricky, and I think even the term low barrier is something that I find that, you know, we do in a specific and intentional way, and most of it's around this whole concept of self-organizing and really having the community that's in there come up with a lot of the guidelines to living, because you're living in a place with 39 other roommates. Most of our shelters have been 40 beds, these ones. I think that there's a bit of a tipping point when you get into above 40, we haven't necessarily been able to do the same kind of community building. It's, I know I've been to other provinces and places where they have these, you know, or I don't know, Texas-style shelters with 4,000 mats or something, and I feel that we probably wouldn't be able to do that same kind of work. Around 40 has been a pretty nice number to be able to have people really live in one room, I think is probably enough. Talk about this first point of contact. One of the things, yeah, I mean, these are the rules. Like all the stuff that I'm showing is basically